sometimes we talk about malaria elimination. People are talking about malaria elimination without addressing the climate change. That the typical climate-sensitive disease and then the environmental variability, the climate variability is important in malaria transmission. So you will see, I'm not going to read. If you go to this page, you will read more. That is why I just copy and pasted the link, because I was supposed to put as a reference at the end. I didn't want that. I brought purposely here for the people to click on it and to read more. So you will see all how the effect is coming in the coming between 2030, what is going to happen, and then how this is affecting the environmental determinant, the clean air, the safe drinking water, sufficient food, and the shelter. All how it happens, it is already written. Please, the second slide, the next slide, please. I want to talk on how things happened on the ground. So this is on Africa. I put also the link here for you guys to read. If you go and read this document, we are almost carrying 50% of the impact of the global. Most of the problem on the climate risk index, if you go to this source, 15% of the high risk, and then the high risk are in Africa. So you will see the problem, why it is important, the One Health approach. Next, please. Next. Yeah, this is the problem on Mozambique. Our colleagues, they invited me to talk on Mozambique. This is the problem in Mozambique. I put the percentage. This is the source from the World Bank. They produced a very important document on each country like this. And then you will see the problem in Mozambique, the frequent is one of the 4 top countries with a very increased and unstable climate risks. You will see the 4 countries, Mali, Mozambique, South Sudan, Chad. They are all in Africa. I think it is only one country, which is Pakistan, or here is not part of this. This is the top 4 countries in the world. Mozambique is one of them. So you know the geographical area of the Mozambique, because it is in the intertropical convergence. They are having this, it started in Madagascar and then come to Mozambique and then reach Malawi and Zimbabwe. It affects us. And then Malawi and the Mozambique alone, they are contributing to more than, to the current cholera outbreak, they are contributing to more than 80% of the cholera cases. These are the 2 countries contributing to that. So, please, yeah. So you will see all the problem. The previous slide, please. I just want to touch one point on that and then go to this, what happened. Please, the previous slide. Very quickly. Yes, so with increasing temperature, we have got from the National Meteorology all this problem. You are mixing, sorry. Yeah, the next, yes. Yeah, so please keep it here. So the low adaptive capacity, one of the problem at the country level, you will see the assessment we have done, and then you will see the droughts. These are the examples, and then you will read it. I hope the slide will be shared. This is the document I brought from the drought, flood, epidemic, and then you will see how the country is affected over the last 14 years. So if we don't plan at a strategic level, we cannot respond in a project manner. Please, the second slide, please. Next. So to address this problem, we have tried since 2018. I used to go to Mozambique, and then I moved totally in 2020. So the first thing we have done, we know the global problem. So we managed to do the advocacy and also sensitization and bring partners on board. the Ministry of Health, different UN agencies and the NGOs, we managed to conduct the vulnerability and the adaptation of the health to climate change in Mozambique, which cover also the environmental determinant of health. When we are saying health, we covered in this assessment the water sector, the economic sector, the infrastructure, and everything. So we came up with this. The report came out in 2020, and we found out of the 160 district, 61 district, you will see we managed to develop the health vulnerability index for each district. So because the planning unit is at the district, I want to emphasize here, we know the global problem, we talk how to integrate, but we need to know how it affects us at local level. So we produced this vulnerability index for all 161 districts. We categorize the vulnerability index into 5 according to the IPCC report document: low, very high, high, moderate, low, and very low. Because this will help, because we have an scarce resources when we are mobilizing a resource. When we are also planning internally, we need to those districts with high, very high, and high to prioritize them. So this exercise helped us to develop that. We use the IPCC model for livelihood because I said the literacy rate is very low. The literacy rate is very low in health. We don't have anything. I went to the livelihood. We adopted this model from the IPCC. We adopted to the health. And then when we did this first in 2015 in Ethiopia, we brought an agriculture professor who is the author of the IPCC on this livelihood. He was the one who helped us to adopt this to the health. So we need to bring other sectors, even they will help. And then this professor, apparently the one who used us in Ethiopia, he went to some few universities in America to present that. But he was an agriculture professor. When we brought him, we want to do like what you are doing for the livelihood in the health sector. So he helped us. So this is the model. We use the same model in Mozambique, and we produce, you see the exposure, and then the adaptive capacity, which is very low. I put it more than 75% of the district, they have a low adaptive capacity. So we saw the sensitivity, and then we came up with the vulnerability index, as you can see. What are the major events in terms of variability? The drought and the flood and the cyclone. You will see some of the districts on the coastal zone, they are exposed to flood, cyclone, and then some of them to the drought also. So it's a triple even climate variability impacting the same district. So the vulnerability index at the district helped to plan what to do in those districts. And so some of the districts, I already said. The next slide, please. Please, okay. The next one, please. Yeah, so from this, we identified those very high. We start implementation of the early warning, alert, and the response of climate-sensitive disease. We focused on malaria, dengue fever, chikungunya, cholera, and the diarrhea. So this is, you can see the capacity building training. After the dialogue and raising awareness, we managed to create the capacity at MOH, National Institute of Health, Meteorology, and the universities, because we have this capacity in the country, but it is just to inject the health issue. We brought the environment, the climatologists, and also the public health people together. We injected the health issue. I was in that initiation and then leading to help these people to understand. And then we leave to them to do the rest of the job. If we gave them we can just reduce the literacy, the low literacy rate with some capacity building, very like 2-3 days workshop, training those university and then research people. So we did that. You can see in 2019 and the 2018, we managed to reinforce the institutional and the human capacity. And then in 2020, we finalized the VA report. In 2021, we actually implemented the EWARS, and then that is where we are. You will see they are producing those maps like for malaria, and then this one also examples of calibration of the process to predict at least three months ahead the outbreak of malaria. This is for malaria, and then there are also for diarrhea and other disease. And also the laboratory capacity building we have done. We managed to buy some equipment, IT equipment, laboratory equipment, and the reagent for the people to work on the sentinel site in those very high district. They managed to go beyond the malaria. I will show you on the lesson. So these are the small things we have done, and we created now in the country the capacity, and they are capable of doing those activities. The university, the research institute, the Ministry of Health, and the National Institute of Health. So please, the next slide, please, not to take too much time. Okay, let me finish with those. Yeah, these are the challenge. So the current, I think the African CDC know very well this, the response, the capacity in Mozambique to respond to this frequent problem of climate variability in the climate change is very ad hoc and then reactive way. So this is the main challenge, the low capacity, focusing on the outcome surveillance. The outcome surveillance, the existing current surveillance, even the IDSR, what is promoted by WHO and the ministry, focus on the outcome surveillance. So we need to go back to focus on the hazard, on the exposure, and on the sensitivity. Why this thing is happening? For example, we are responding to cholera, we are reporting on the outcome surveillance, but we need to go back, the force back surveillance, to see why it is happening. If we want to stop it, we need to go back. That is one of the challenge, and the capacity, the coordination, lack of resource, all is this problem, and then the response to shock. The last slide. So really, I want to emphasize this, the capacity building at national and also at local level is very important, including mainstreaming different health surveillance platform. The individual level, the institution, and the system. The human resource is there, but we need to inject the capacity building. The next one is the evidence generation. We need to use that to advocate and persuade the decision maker to help to create the ownership. We don't need to respond in a project manner. We need to respond in the development plan context to the local problem. The third one is the linkage with the university and the research institute within the country. If we create that, for example, in Mozambique, we managed to integrate to the Master of Public Health one module on climate change and the health. So they picked as a research agenda. A few of them, they did their thesis on that. Now they are an expert on climate change and the health. And for example, in Ethiopia, 15 credit hours is accredited by Addis Ababa University to integrate climate change to public health and also as continuing education. The partnership is very important. For example, in this one of the typical example, I gave a 2-day training for 16 NGOs, those who are getting funds from different donors, how to integrate the climate change into their programs. For example, the UNEP, the Safe Hospital in Mozambique, we in partnership, we managed to integrate the resilience issues. The availability of the financial is very important. And then addressing the vulnerability community also, and the indigenous knowledge when in the openings has been said. is very important. The way they are responding to that is very important for us to consider in the planning as One Health. The last slides. The last one. Yeah, this has been said, but we took down, my colleagues talk on this one. We developed this in 2016. Now, just it's only, we took down to the healthcare facility level. This is the last on the right side, how to do it now. This was in 2016, is a national level, how to do the 10 component within the 6 building block of the health system. But in 2021 and the 2022, we took down how to address this at healthcare facility level. The health workforce, the water, sanitation, hygiene, and the health care waste, the energy, and also the infrastructure, how to make those infrastructure resilient so that they can give the healthcare service delivery during, after, before, during, and after. So these are how we need really, we have the tool, how to take down to the ground in terms of the health sector. Thank you very much. So we need to look at this in the 6 building block. We need to look at also the last, the community and the healthcare facility level. Thank you very much. Obrigado. Thank you.
There's something about data that just brings the reality in. Top three countries in Africa. These are scary indicators, but really should drive our conversation. And really, thank you so much for that input. Welcome to you, Dr. Judy. I know that we'll be having a bit of a conversation style for your session. So thank you. I think I should join you there so that we can have a nicer discussion.
Thank you very much. I'll come over here and sit next to my colleague because once every 10 years, I have the privilege of seeing him again. He's part of my story. And because we're only here for a short time, I shall sit next to you, colleague.
Thank you. Thank you.
All right.
Dr. Judy, of the work that you are doing as a vector-borne disease epidemiologist, how can collaboration between researchers, policymakers, and public health officials be strengthened to ensure that some of these findings from the research that you and many other fine scientists across Africa are doing can be effectively translated into actionable strategies? Understanding that Africa is the most vulnerable continent and Africa needs to really use its data to facilitate this process. Over to you.
Well, thank you very much. And thank you for this opportunity to talk. I would like to steal that opportunity a little bit and tell you my story. Africa is the home of stories. Africa is the home of stories. We must be able to tell our stories ourselves. And as I look around this room, and I've mentioned just a few minutes ago, there are many characters in this room who are part of that story. This discussion about climate and health dates back about 2.5 decades. I know because I was there. Waltalji was there as well. And there are others who I might look at, but I'm not looking at them directly, who are also there. And it's really nice to see that there has been a massive paradigm shift in the understanding of climate and health. And not just in the understanding of climate and health. Public health has changed massively over the years. We are at a point now where Africa has taken control and has understood many, many issues for ourselves and taken the leadership. We have the solutions for infectious diseases, don't we? If we look around this room, nobody is worrying about getting cholera because it's raining, because all of us have achieved our sustainable development goals, haven't we? You and your family don't worry about health insurance. You don't worry about going to hospital. You don't worry about not having food. So the point of saying this is because it is indeed possible in Africa to achieve the sustainable development goals. The issue is not the diseases. The issue is more about logistics, equity, access, governance, management of things. Okay, so when we come at this story that began about 25 years ago, when we first mentioned Africa, climate and health, we are still talking about the same things. Whereas the challenge of climate is very much something of in the future, something that we as a sector need to keep our eye on that ball about. We worry a lot about those diseases, whereas the crisis that climate is bringing to our continent is more about emerging issues. It's about emerging issues. So as a sector, we need to be thinking about how we can keep our eye on the ball of emerging issues. So all these discussions need to focus on that. And I think after 25 years, 30 years or so, we need to be rethinking how we can frame this so that people can understand what we're talking about and where we're coming from. Every time we think about development, we think GDP. And the result is always, okay, let's see how we can make more money. The priorities, of course, will then be, let's innovate in energy, let's do climate smart agriculture. And in that, nobody talks about people. Why are we doing anything? This is about our survival as a species and as people. And people need to be in the center. And what is it about people that is really important? It's their health. It's their food systems. Anything that prioritizes extraction, we must understand, is not sustainable. If we take it out of the ground, if we take it out of the sky, if we take it out of something else, we're taking out is not sustainable. Our population in Africa is really growing. So let's think about it that way. What is it about health that we need to look at? What is emerging? We have the solutions for infectious diseases. Our team at WHO know what to do. But he didn't mention, oh, we don't know how cholera is caused by climate change. We know those mechanisms. He was mentioning how many people were impacted. How do we move medications? How do we look at AMR? You know, the things that my colleagues from Africa CDC really don't lose sleep about. Those are the more important things about logistics. But in terms of in the future, what is emerging out there? How can we keep our eye on the ball? And for this, we must take leadership. So there's been that change where we're not looking for others to come and tell us what to do. This is very much an engine that's being driven from here. And I really laud the Africa CDC to give us that freedom to say that we must be thinking about everything in a sort of interconnected way. Okay. So beginning with things like we must innovate in education. Let people grow up understanding that if I take out of the ground, I'm doing bad. If I poison that ground, I'm doing the wrong thing. We have a really diverse population, and diversity is a real indicator of ability to survive into generation and generation. We have environmental diversity, diversity of thought, diversity of people, different types of genetic diversity across this continent. Is to our advantage. So let us start from that position of power and then look and address your questions that you are asking. I was asked to actually talk about collaborations and between research, policy, and public health. I put that background because first we must make sure we have framed it correctly. Otherwise, we'll continue to be left outside. If development is not, if people are not in the center of development, then we are starting at the wrong place. It's important to frame it that way. And people, it is about their health. We must, as a health sector, say, this is what we see as really important. And this is why we want to have people at the center of that. And bring governments to just understand that. Collaborations require us to be sitting in those policy spaces. Invite us in there. There are no channels for researchers to sit in policy. Where am I going to go with all this information in my head? Except sitting in my office, you know? I want to hear how the CDC makes decisions before I complain about what the CDC has done, you know? I want to hear why the government has prioritized climate smart agriculture and not prioritized health? I want to understand, because we know CDC does not make decisions without having thought through something. The government does not make decisions without having thought through something. Let us be there and listen. So then when we're talking about partnerships, we make them strategically. You can only collaborate with somebody who has the same thought process and is thinking in the same way as you. So let us understand how each other is thinking. We make strategic partnerships. I can see, for example, a team from Wellcome who for a long time have been thinking about climate and health as well. You know, can they come and understand from our side as funders so that we take leadership of that agenda and drive that agenda? The collaboration needs to start with that equity of partnerships at the focus and in the middle. And I think, you know, just having that baseline so that we design those questions, collaborative here, and then go out to see how can we best address them with the broad knowledge across all different sectors, whether it's energy, whether it's agriculture, food systems, or the environment.
You'd have to agree with me, ladies and gentlemen. That was quite captivating. I haven't heard climate and health being framed in such an advocative manner. Quite impressive. And I think one of the things that I'm hearing and we really need to think about, and a lot of our speakers have really emphasized, is that at the end of the day, people are all that matter. We need to have homegrown solutions. What I'm hearing clearly from our speakers is Africa does have the problem. We are experiencing it, but it's time to really create homegrown solutions and really address it based off the answers we have. Allow me to use this opportunity to plug in here, as we have some of the finest scientists in the room. Come November this year, Africa CDC will be hosting the biggest conference in Africa, the conference, the CIFIA conference, which is going to be in Lusaka. And there is a track particularly on climate change. And this is an opportunity for us to really bring that science closest to the policymakers of the African Union. So this is an opportunity, a welcome. We are opening our doors to you. Join us in Lusaka later this year. Allow me to go on to our Zoom speaker, Dr. Madina, if you're there. Dr. Madina?
Yes. I'm
Fantastic.
there. Okay.
Lovely.
I share my
So I've got a question for you, which I'd like you to speak on to. It's really around, again, really emphasizing what Dr. Judy said. And from your experience around how to empower African research institutions, I'd like you to please maybe speak about some examples on how we can ensure we have sustained efforts to ensure that we can develop context-specific solutions to address the challenges in the African communities. So over to you to just answer that question. Thank you. Dr. Madina?
Hello, do you ask me? Thank you, Dr. Bonde.
So
Thank
just
you
a second.
for the organizer. Do you hear me?
Just a second. We're just doing a panel right now. But if you'd like to do a presentation instead, I just come back to Dr. Judy and we can continue the conversation, then come back to you. So Dr. Judy,
okay,
back to you. Yeah. Thank you so much, Dr. Madina. So back to you, Dr. Judy. You have raised really pertinent solutions, really good questions for us to go back and think about. But you agree with me that we are a continent with limited resources. You have raised that there are opportunities for partnerships. Maybe you can talk a bit about how international collaboration and capacity building initiatives could potentially be useful for research and policy.
That's an important question, and thank you for it. I think when your resources are limited, then what you normally do, you go out and say, I have a little bit of money, but you must prioritize. And I think an exercise and a system, a well-tested system of prioritizing what's important for the continent is crucial, it's essential. We have so many parallel activities that are happening. different groups are doing things in climate. Well, you mostly see them when you have a meeting like this, when 30,000 people descend upon Nairobi, and many are doing the same thing. There's a group outside there that's called researchers. There's another group called policymakers, but then within those, there are so many subgroups. I think an exercise where we have a all-encompassing process to say these are the priorities that we need to address, and then reach out for solutions, but not in the sort of way that we have done it in the past, where everybody says, okay, this is a problem, and then we all go off and do our own thing. Okay, this is a massive challenge requiring really, really good planning for it. I think when we think about food systems, for example, there's a whole issue in Africa around wastage. There's a lot of wastage. If you go to markets anywhere on the continent, everybody is throwing the cabbages that are a little smaller than the other ones, or the carrots that are shorter, or growing things that we don't eat. For example, I know we grow a lot of French beans, which are delicious, but which Kenyan eats French beans? I mean, really, can we think about our own food systems? I eat every day, for example, we eat kale, we eat the skuma wiki. Do I have to wait for it to come from another county so that I can eat it every day? So there are ways that we need to be looking at how we manage our food so that we don't suffer hunger, nutritional issues in other counties when there's so much produce being wasted in other areas. So let's look at those things like that. Can we make sure that people are remaining healthy, that we are growing healthy food that doesn't have to be transported? Because that's where contaminants enter the food chain, when it has to be moved from here and there, or imported, or policies that make sure that prevent food from getting to the people where they need to do. So it's again about framing and logistics and planning and prioritizing.
Thank you very much. With a big round of applause. Thank you so much, Dr. Judy. Very insightful. A round of applause for Dr. Judy. So my panel is standing between you and lunch, and we will take one last speaker before we wrap up this session. Dr. Madini. Madina, you're up. You've got 5 minutes, unfortunately, for this presentation. So thank you very much. IT?
Yes. Thank you, Dr. Vonde. Thank you for the organizer to invite me to this opportunity. I'm Dr. Madina, a lecturer researcher for University Peleforo, Gon Coulibaly, Côte d'Ivoire, and researcher associated in the Centre de Recherche Scientifique in Côte d'Ivoire. My claim concerns building local capacity of climate and health researcher in Africa. What's happened in Africa? We have urbanization, a key challenge of environmental issue in Africa. Continent with many cities become mega city, a strong increase in urban pollution. This urbanization leads to development of anthropic activity, increased agriculture, productivity, deforestation, air pollution, flooding problem.
Excuse me, Dr. Madina. Please. Dr. Madina, can you hear me? Sorry to interrupt, but we have interpreters, so please feel free to present in French. Merci.
Hello?
Dr. Madina? Yes, please. You can feel free to speak in French. In the room, we have access for interpretation, so please feel free to make your presentation in French if it's preferred for you. Thank you.
No problem. I can continue in English. Yeah, no problems. It is okay? Okay, I can go. I saw all these issues are or have an impact of both climate and the health of population and animals. For example, with climate change, countries in Africa will face increasing challenge, mainly malnutrition, malaria, meningitis, infection disease. So, research scientists have an important role to play in finding the solution of this problem. However, Africa comprises 15% of the world population, but bear 25% global disease burden and produce only 2% of the work output. This is very, very low. What contributes to the power research result in Africa? Significant challenges that contribute to this power research output include: number one, we have a dearth of well-trained and skilled researchers in climate health, resulting in power supervision of higher degree scholars. There's a weak of very limited progression pathway of the in scientific career because of a lack of data. Data is very, very important. When, for example, if you want to study malaria, you need daily precipitation. You need to temperature minimum or temperature maximum data. Data is very, very important. After, we have a poor research infrastructure, including a lack of access to scholarly tools such as a supercalculator, and finally, a lack of interdisciplinary team according to the issue in climate health. Now, building structuring research activity becomes very, very important. Basically, identifying and offering quality training and current development opportunity to large number of junior African scientists and support staff. After your implementation of national supercalculator and the modernization of data acquisition approaches, then set up an innovative pilot development project to provide to climate and health issues. It is important to enhance African mineral and energy resources such as solar energy and mineral. Enhances sky and training response and emergency team. Operationalizing early warning system SRM is very, very important. For the better communication of benefit of using research output, climate information is disease become need. African group of atmospheric science ANGA played an important role to put together the disparate perspectives in Africa. We are used to support CCR assessment, which lays the roadmap of the development of Africa considering climate change and air pollution. Do you see the next slide?
No, we don't.
No, I don't know why.
Okay, we see it now.
Okay, yes. Building local capacity requires more funding. So that we need a long-term investment from donors and increased funding commitment from African within need to realize a local capacity and to create and sustain world-class research. We have some examples, African of Science and some of the National Institute of Health. So we are African Center of Excellence for Climate, Biodiversity and Agriculture, such as CACCBAT, WASCAL, SASA, which finance PhD and master master study. And a Pan-African network, African Institute of Mathematics Center with finance postgraduate training in mathematics science. Okay, we will quickly finish to say that Africa capitalizes on development opportunity to improve and strengthen research on climate and health. The scientists will play a key role in building local capacity for research, innovation, training, awareness raising, and the best way is to support models for merge all knowledge information flow and use a cross-relevant academic discipline, partner, sector, and stakeholder applicable to link climate and health. Thank you for your attention, and I'm very, very happy to take place in this important panel. Thank you.
Thank you very much, Dr. Madina. And you can hear from the room a loud round of applause for you. Really engaging and insightful discussion. First of all, I'd like to thank my online speakers and panelists who joined this morning, and also to my colleagues here, Mr. Katunde and Dr. Judy. Thank you so much for joining, and a big round of applause, of course, to you, the audience. Thank you very much. So it's been an interesting start. Thank you very much for being very engaging. Because of the time, we would like to stay on to the time. We will now proceed for lunch and get ready for next session. Okay, fantastic. So I welcome my colleague now, Ms. Shingai, for the next session. A big round of applause for Ms. Shingai.
So a big thank you to Dr. Wande for getting us going today. I think most of you already know her, but I wanted to give you a bit of background about who she is and the work she does for Africa CDC. So Dr. Yewande is our One Health Unit Lead. She doesn't like us acknowledging her for all her work, so I'm taking this opportunity to do so. She has been leading various activities for One Health and AMR control, and is helping us shape the direction which we are going to be taking in terms of how we are going to be contributing in this area of the nexus between climate change and health. So thanks so much, Dr. Wande, for moderating this first session. So our next panel is going to be looking at enhancing disease surveillance and early warning systems, integrating human, animal, and environmental health. And the point of this session is for us to be able to emphasize the importance of collaboration amongst human health, animal health, and environmental experts. And I think our first panel did a very good job of trying to make us understand how these three are interconnected. We also want to explore the approaches to enhance disease surveillance, forecasting in the context of climate change, and also climate change data in predicting disease outbreaks, as well as ways to implement One Health approach in practice, and also looking at some good examples. So I would like to call up my speakers for this panel. We have some here in person and some that are joining us online. And so I would like to call up Dr. Agnes Kiraga. So Dr. Agnes Kiraga is the head of data science at the Africa Population Health Research Center here in Kenya. A round of applause for her. Thank you. I would ask Dr. Yewande Alimi to please join us, our One Health Unit Lead. Thank you. Online, we have our two speakers. We have Dr. Yenu Kebede. He's our Acting Head of Surveillance at Africa CDC. And we also have Dr. Thandi Kapwata, Specialist Scientist in the Environment and Health Research Unit at the South African Medical Research Council. Welcome to our colleagues that are joining us online as well. And just to check, Dr. Yenu, Dr. Thandi, can you hear us?
Yes, Shingai, I can hear you.
Thanks, Dr. Yenu. Dr. Thandi? Okay, colleagues, let's help to follow up Dr. Thandi while we get going with the session. So I'm going to start with you, Dr. Yewande. One of the challenges in implementing the One Health approach is balancing the interests and priorities of different sectors. And we heard from Dr. Ahmed and other speakers this morning that health in the climate change space is an optional extra. So how can policymakers and local leaders ensure that when we talk about One Health, we can push forward a One Health approach that's integrated into the decision-making process to make sure that the health agenda comes through clearly in the climate change discourse?
Thank you very much, Shingai. And really good question, because one of the challenges that we have seen is operationalizing One Health is quite a task. And rightfully so, because individual organizations have their mandate. For example, the organizations that will say their mandate is primarily focused on environmental health, others will say on agriculture, others will say on human health. But we forget how interconnected all of these things are, and it's impossible for us to have resilient health systems unless we work together. One of the crucial things that we are doing at the level of the Africa CDC and the Africa Union is really showing that exemplary means of intersectoral, multi-sectorial collaboration for One Health, and understanding that, yes, indeed, our priorities can be aligned on the One Health approach. For climate change, it's quite interesting because, as you can hear from a lot of the speakers, it's very siloed in the sense that climate and health is just another agenda on side meetings, never a priority. We think about it as we need to throw less plastic into the ocean, but we don't realize that what does the impact of the plastic in the ocean really mean for the average person in rural Kenya, for example? What does it mean in terms of Somalia and the drought implication? What does it mean when we say that all of a sudden we are seeing a rise in malaria cases in countries that have not reported it in the past or have eradicated it? So I think it's quite important for us to see climate change not as a separate entity of health system, but really the core of our existence. Where are we right now? We are on Earth. We're part of the ecosystem. We think about it like, oh, we're separate. So it's time for policymakers to really think about it in a very holistic approach, understanding that organizations need to collaborate. We need to prioritize health, because at the end of the day, you've seen the figures, they're quite concerning. And the whole essence of health is really for the people. So it's quite important for us to really re-strategize our thinking and think of things in a One Health approach, ensuring that it's not just human, animal, and the environmental sector. What about finance? How do you want to make budget lines for One Health if you don't bring them to the table of discussion? Think about urban planning. That's why we're building houses on canals or on rivers, or that's why we are dredging the rivers, and subsequently the impact of climate change. So we really need to take things in a holistic approach, understanding that, yes, indeed, there are key sectors in the One Health space, but at the end of the day, One Health is really about the people. And as such, the needs of the people really need to be reflected in the climate change discussions. Thank you.
Thanks so much, Dr. Yewande, for that very passionate response. I think, like you said, a lot of us don't consider that we are part of this discussion and we contribute every day. On Sunday at the AMREF dinner, we had the pleasure of listening to the Minister of Health from Malawi and the Cabinet Secretary for Health from Kenya. And both said something which I think stuck, which is health is the face of climate change. We are, when you talk about climate change, the final effects of it are felt by health and those working in health. So let's move on to Dr. Agnes. So one of the fundamental tenets of One Health is the link between agriculture, human health and environment, data and research. That's a lot of things that are connected. And so the data and research play a key role in policy and resources. Could you share some examples of successful initiatives where principles of One Health data has been applied to climate change impacts on health? And if you still have time, you can also tell us some of the impacts of extreme weather events on vulnerable populations in Africa.
Can I give my presentation? I have slides.
Okay, can you please bring up Dr. Agnes's slides?
All right, as we wait for the slides, I'll just, oh, here they come. Thank you. Thank you for the opportunity for presenting here on behalf of the African Population and Health Research Center. In Africa, when you're sent to a meeting, your parents always ask you to send greetings. So I'm sending greetings on behalf of APHRC, which is an African think tank that made 20 years. And we are located in Nairobi, headquartered in Nairobi and with an office in Senegal. And we are key to transforming lives in Africa through research. So we have a footprint in about 35 countries. And in addition to very many other programmatic areas, the research program is keen on developing research around health and well-being, population dynamics and urbanization, human development, and data science. I currently lead the data science program, and I'm happy to be in this discussion to talk about data and how it intersects with all the discussions we've had today. Next slide, please. Okay, I think we've all had very many of these tendencies before. We've had data being referred to as the new oil, or data being referred to as the new nuclear power, or the new currency for digital economy. As we talk about One Health, climate, and whatever we need to do to ensure that these are the same discussion, data is at the core of this. We cannot go ahead, or we cannot proceed much or make most of the evidence that we want to get to drive climate change in Africa without putting data at the forefront of all the discussions. As a data advocacy, I am my day-to-day job is really to tell policymakers, partners, Africa CDC, to be at the forefront of promoting data use in Africa as we are going to address climate change. Next slide, please. So I'll skip the examples of what climate and health have interacted because of the previous speakers. But what we propose as data scientists or people at the core front of data is to have these three domains come together if we are to have consolidated approaches to climate mitigation, climate adaptation. We need to provide frameworks that are going to bring together different data sets from the animal domain, from the plant domain, from the pathogens, from the ecosystems, bring this data together in addition to the climate data that is available. We create systems that are going to allow a lot of data sharing, data governance to drive climate change. And I can give an example of scenarios where we are conducting studies in Africa, and you go to this country and ask for weather station data. It's difficult to get the data. You have to engage most of the ministries to have access to these data sets. So in the bid to actually promote climate change and to use data as the driver, we need to have systems that are going to recognize the value of sharing this data in the ecosystem. climate governance models that are going to be central to Africa CDC or the Africa Union as we talk about climate and how it interacts with health and One Health in the continent. Next slide, please. And I'll go to the discussion, but just to say, I think in the opening ceremony yesterday, President Ruto said, this opportunity for climate and health is not for us to catalog issues. I know that there are various issues that lead to the disparate way data sets are collected in Africa. Some of the data sets coming in from the different domains that contribute to One Health are siloed. If we do not put these in the same space and harmonize these data sets, make them in a manner that can be shared across the different researchers, the different implementing partners, the different players who are at the center of using this data to make policy, it becomes difficult to make very good evidence that is going to be critical as we are developing strategy for data. So some of these are around limited infrastructure that we need to invest in. Skill set, Dr. Hauptmann has said about the lack of curriculum or academic programs that are targeting climate and health. This skill set is very critical to the advance of promoting climate as a capacity building in data science, climate health, and other attributes that are going to be very critical to addressing climate health. We also need to invest in computational power. There's a lot of advances around big data, and which we are collecting every day. But without this investment, we really need to see how we're going to use that. We need to see how artificial intelligence is at the corner of driving climate and health and One Health. Can we share these data sets? Can we predict epidemics? Can we use this for epidemic surveillance and epidemic intelligence? And can we share our data? I think for me, there's discussion right now as a data scientist to make sure that whoever is in the discussion is at the core and very sold on board in terms of sharing their data. Is it ethical? Is it reproducible as you promote it for addressing One Health? So I'll stop here and then take on the next questions. Thank you.
Thanks so much, Dr. Agnes. So before you sit down, let me ask my question again. Do you have any examples of successful initiatives where One Health data has been applied for climate change?
I think there are studies that have looked at combining different domains. There are studies that have looked at maybe vaccination of humans at the same time. Can I sit? So when you're looking at vaccination, so there are studies that have vaccinated pastorists when they are actually we're providing vaccination for animals and pastorists at the same time. So in this space, you're actually addressing a One Health issue to address zoonotic diseases. So those are some of the examples that come off very clearly when you're combining One Health. And of course, some of these issues come around policy that have to be in place if we are to tackle these missed opportunities. If you have pastorists who are also not vaccinated against COVID, you can actually use this same stone to kind of address both health issues at the same time. So those are some of the success programs that are out there. And then you talked about issues around climate and extreme weather climate. Yes, we've seen a lot of advocacy around extreme weather conditions. These include floods and heavy rains and floods and outbreaks. So some of these have not really been correlated very well with mental health. We have a project that is looking at extreme weather conditions and mental health funded by Wellcome Trust. And we are seeing, particularly in adolescents, that when you talk about extreme weather conditions, you're talking about food. But some of the populations are dealing with other issues like anxiety, depression as a result of mental health, which spills off from floods and poor weather conditions, lack of access to education, lack of access to social services, loss of lives of their parents. So some of these extreme weather conditions are spilling into mental health issues of psychosis, depression, and anxiety among the populations in Africa. And we need to look out for those as we talk about climate and its impact in Africa.
Okay, thank you so much, Dr. Agnes. You've touched on the issue of data and also brought up the social components that often get left out even in health. I'll come back to the social components, but I want us to continue with the discussion we're having on data. So Dr. Yenu will go online. So the integration of regional climate and health data contributes to development of early warning systems for disease outbreaks in Africa. So can you tell us a little bit about how the increased integration and collaboration can help us, can benefit all of us? That will be the first question. And then can you give us some practical examples of how this integrated approach can lead to improved preparedness and response to health challenges? Over to you, Dr. Yenu.
Yeah, thank you. Thanks, Shingai. I have a few slides if the IT can show, or I can share also from my side, if that's allowed.
Sure, they're bringing up your slides now.
Excellent. In the meantime, let me recognize the panelists and also the speakers this morning. I think they simplified most of my talk here because a lot of those things have been covered. So let me take a few minutes of your time before your lunch to really emphasize the importance of improving surveillance, leveraging other data sources, climate and weather forecasting, and environmental and other data sources, so that your surveillance data is powerful for you to prepare for the worst. Next slide. Yes. So many of you have spoken about the impact of climate change on health and how Africa is more vulnerable, and you have seen an increasing disease pattern. Some of vector-borne diseases coming to the highland. We have seen widespread cholera outbreak because of cyclone, and there are really other diseases that are also spreading because of poor access to clean water and sanitation, and there are a number of examples. So I think it was also the consensus and the right approach that we need to approach this one in one health concept, where we'll be looking into very comprehensive and multi-sectoral strategies to mitigate the impact of climate change on health. Next slide. I think everyone knows what One Health means. It is really an approach where we work to attain an optimal health outcome for people, animals, plants, and the environment that is shared. And this is what has been being emphasized by Africa CDC and many other partners. Next slide. So Dr. Ahmed, in his opening speech, I think he described very well in terms of what the Africa CDC One Health priorities are. We are actually looking into zoonotic diseases, supporting countries to do zoonotic disease prioritization and to set up surveillance systems, and also help them some coordination mechanisms across multiple sectors to deal with zoonotic diseases. Antimicrobial resistance is a big issue, and it's in fact it's called a silent pandemic. It's really a very big challenge unless you approach it in One Health approach, so you cannot have an effective control mechanism for AMR. So we have to address multiple sectors to bring that down. And the food safety, of course, has been described in this session. It's important to reduce foodborne diseases. It also is important to safeguard the market of food industry. And climate change, of course, is a talking point, and its impact is significantly increasing. So we need to come up with an important mechanism to mitigate the health impact of climate change. Next slide. So these are some of the factors that were described by previous speakers, why zoonotic diseases are increasing. And I think in the last In the last couple of years, zoonotic disease as a cause of outbreak, the incidence has increased by 30 to 40%. Because of many reasons, because of deforestation and other land uses where people are encroaching into territories that never have been occupied. Antimicrobial resistance is making disease control difficult in domestic animals. There's also illegal and poor regulated trade of wildlife and climate change. All those are important reasons why zoonotic diseases are emerging. Next slide. So if you see the Africa CDC event-based surveillance, we have an event management system, which we have been implementing, I think, since 2020. And over the last 3 years, we were able to capture 616 events using this system. Out of that, 500 are human events, and these are mostly zoonotic diseases. Again, strengthening our previous findings that zoonotic diseases are on the rise. And then we have some animal events. We do have also some environmental events. So this tells us that we need to do more in terms of bringing these sectors together in capturing your data system and use that one for early warning surveillance and preparedness. Next slide. So many of you you have mentioned it. So cholera is directly linked with climate change. We have seen that one this year where there was really a significant increase in the number of cholera cases and deaths because of tropical cyclones and severe drought. And this looks repeating itself every year and on intervals. So this tells us that we need to use the weather forecasting, the climate change data, to prepare the continent better and to work on our preparedness and response strategies. Next slide. Another example is Rift Valley fever. Every year after heavy rains and flooding, you see a number of Rift Valley cases, both in livestock and human population. Again, if we can predict, this is happening, then we can prepare ourselves and do, our surveillance program, early warning, so that we reduce the impact of Rift Valley fever on human population. Just as an example, it's directly linked with the climate change and also, some weather conditions which can be predicted, and that data can be used to really reduce the incidence of this disease. Next slide. So if we have that surveillance data, and we can use that one to do, a One Health interventions, dealing with data from animals, environment, plants, use that data to set up our response systems, and then that coordinated response will significantly minimize, the impact of diseases which are exacerbated by climate change. Next slide. So let's see this one very, very carefully. If we see most of those zoonotic diseases, there is a sylvatic cycle in the wildlife before there is a spillover into domestic animals and the human population. So if we know, whatever is happening on the wildlife side, and then it will help us to prepare ourselves to develop, medical countermeasures, and then we can significantly reduce the spillover to domestic animals and the spillover to the human population. The usual route is, wildlife to domestic and then to humans, but at times because of all those, environmental changes that we mentioned, there can be also, a direct spillover from the wildlife population into the human population. So it's important that, we consider this cycle to really, reduce the incidence of many of those zoonotic diseases. And the new pandemic usually comes from the wildlife population. And I think it's happening, every 10 years, every 5 years. This year it was COVID, and next, we don't know, it will be one of the viral infection. that is circulating in the wildlife will cross into the humans and then becomes a global pandemic. Next slide. So in line with what Agnes was mentioning in her presentation, I think it's important to consider different outlets to bring this data. This is an illustration of the Epidemic Intelligence Hub that collects data from different sources, from clinical science, ports of entry, from community, from the animal sector, and we use also environmental surveillance. So if we can combine this one, this becomes really a powerful tool for us to make any public health decisions. Next slide. Yeah, in the interest of time, this is describing the same thing, a model, coordinate surveillance model that if employed can really help us better strategize to address those epidemics and pandemics. Next slide. So let's again, in line with my earlier description, let's see the different interventions. Today, some partners have the 100-day mission for pandemic prevention, preparedness, and response. For example, if we see what Sept is trying to do, they are trying to understand, what are the potential viruses that can cross from wildlife to the human population. And then if we can have the potential to forecast that one and be ready in terms of preparing, our vaccine manufacturing, diagnostics, and medical countermeasures, and then we can significantly reduce the impact on domestic animals and then the human population. So this is doable. They are coming up with some, potential viruses that can cross over and then do, some preparatory activities so that we are prepared for any next pandemic by a new or novel etiologic agent. Next slide. So all global initiatives, the quadripartite partnership with FAO, the Animal Health Organization, WHO, Africa Union, with AUI, Bar Africa, CDC, and PAMVAC, we are promoting this One Health approach because that is the only solution that we can mitigate, the impact of climate change, and also all those priorities that I mentioned, antimicrobial resistance and zoonotic diseases and so on. So we'll continue, pushing this collaboration. It's really, a working collaboration. So we want to emphasize that, this is a way to go, and we need to join forces to promote One Health approach. I have one final slide. Yeah, these are the different, frameworks that we have been promoting. We have a One Health practice framework for One Health practice for national public health institutes. We do have, the Africa CDC event-based surveillance, which recently was revised to consider and emphasize One Health approach.
Recording in progress.
The early warning systems, surveillance, how the different types of data link into the One Health approach. So you've also then talked quite a bit about Africa CDC's approach and resources that we've created. And so my question to you is, how can everyone work with Africa CDC? Sorry, Dr. Yeni, I'm not sure if you heard me. I was asking, how can everyone contribute and work together with Africa CDC?
Yeah, I think that's an important question. We have created platforms of coordination at a different level. So I think we would like to, invite many partners to join force with us in different platforms. As I mentioned, we have this quadripartite coordination mechanism, and at African Union level, we have also, set up a zoonotic disease prioritization working group involving the AU IBAR, PAMVAC, and many other AU departments. And then we have also, some regional technical working mechanisms for some of the disciplines, like our event-based surveillance and other surveys. So I think it's important, we use all those fora to engage partners and push this agenda forward. In addition, we work in a very consultative manner to come up with those continental documents, like continental frameworks. So it's important that partners, when they interact with countries, they promote the implementation of those common frameworks, which we think are really very critical to address some of the challenges that we see at the ground level. So there are a number of avenues, and we are also open to hear from partners as well in terms of their approach. We want to work very collaboratively. So I will suggest all of those avenues to be used as a coordination mechanism. Thank you, Shingai.
Thanks so much, Dr. Yenu. So I'll go back to Dr. Yewande. So we've heard quite a bit from Dr. Yenu, from Dr. Agnes as well. I wanted to ask you, sorry, if we can just share our our mics. If it was during COVID, we'd have to share sanitizer, but thankfully that's passed. So I wanted to ask, one of the challenges with One Health is balancing the interests and priorities of different sectors. So how can policymakers and local leaders ensure that the One Health approach is integrated better into decision-making processes and that relevant sectors work together?
Thank you, Shingai. And just going off what Dr. Yeni has really highlighted around the partnership, I think one of the examples we are most proud of at the African Union level is really our collaboration with the quadripartite. And we have been able to work across it using a One Health approach, whereby our organizations are able to individually champion where their mandate is, but we speak in one voice. A lot of people have highlighted some of the success around antimicrobial resistance, and those are the lessons that we are borrowing now. For example, 6-7 years ago or thereabouts, antimicrobial resistance was very, everyone is blaming the agriculture sector, it's overuse in agriculture sector, antibiotics. But over time, one of the strategic things that we did at the level of the African Union, led by Africa CDC and AUIBA, is collaborating with our quadripartite partners, and I'm so glad to see our colleagues from UNEP here as well, as really creating what the narrative should be for Africa. And we see that climate change presents similar opportunities using a One Health approach. We understand that the center of our existence as organizations is really on humanity, is really for Africans. As such, we're able to bring our different mandates together, define clearly roles and responsibilities. I think for One Health to really function, that is always a key thing to do. You have to clearly define who takes a lead in what the roles are, what the responsibilities are, anchored to the people, anchored to the community. So in terms of the work that we do at One Health, and in terms of how Africa CDC and the rest of the partnership across the globe, across the African continent, is really for Africa, by Africa, using a One Health approach. Thank you.
Thanks so much. So I'm just checking, has Dr. Tandy managed to join us online? Okay, so I'll go back to you, Dr. Agnes. So continuing from what Dr. Yewande has just answered, how can policymakers, researchers, and local communities collaborate effectively to promote transdisciplinary research and action in climate change. You touched on this in your slides. You had a very nice pictogram that was showing, the different areas. But practically speaking, how do we get these different stakeholders to work better together?
Thank you. So as we address the whole, bringing these stakeholders together, I'm speaking in the context of getting them to the same table to use evidence that is going to address climate change. When you look at how data moves, it's a whole chain, literally. It's a whole chain from the communities from where the data are collected. Every day, each of us here is generating lots and lots of data. If we are to get the community to understand the value of climate change, they need to know that they're contributing to it in a certain way. You need to increase climate literacy at the community level. If you need to get a policymaker to talk down to the community in whatever information models that you want to use, you can bring the two together at community level and say, look, if you throw plastics in your community, it's going to spill down to X. So at the very bottom of the data chain that feeds into the whole climate change, there's need to be very effective communication strategies. Sometimes when the policymakers or the analysts or the scientists come up with results, they can't communicate them back to a manner that feeds the community. So we need to have very strong communication at that level. We then also need to take it a step higher for the teams, the researchers, the livelihood guys, or the animal researchers, or the cattle keepers, anybody involved in animal husbandry. They also need to know their contribution. I think it's a stepped wage policy that needs to accommodate the different players in the climate change, that needs to be curtailed or customized to the different players. If it's an analyst who is doing this work, or if it's a policymaker and the analyst has also created a very fancy graph, it needs to be communicated in a manner that they'll get those results, take them back to the policymaker, include them in the budget discussions when they are creating the policies or the frameworks that address climate. We all need to have very clear communication. Then two, I would not stop saying there's need for very strong governance structures. What is a governance model of all this? How do you get the different teams to play? Everybody's contributing a slice of that the whole data governance structure, the protection of the data, the communities, the way it's analyzed, the way the results are fed back, the way the policies are generated. It's a whole pie chart that everybody has to fit in, with very strong governance structures that accommodate each one's player. So in a nutshell, we need to understand the different players, what they all bring, but also recognize their contribution, and also, recognize what structures we need to put, what capacity building we need to empower each and everyone in their different domains, so that we all at the same table when we are making policies that address climate change.
Okay, thank you so much, Dr. Agnes. So if you'll allow me, I would like to turn to all of you participating. Thank you so much for being very attentive with our first two panels. But I do recognize that we have a wide range of experience in the room, and we do want to hear from all of you. So would like to open up the floor for you to give us any comments or questions. And I ask that before you speak, just let us know your name and the organization that you come from. So the floor is open. Please just raise your hand. Yes, please go ahead.
Hi, everyone. I'm Joseph Wangendo. I work for Africa CDC. My question is to Dr. Yenu or Dr. Wande. I wear another hat. I sit on a board of a conservation organization, a primate conservation organization here in Kenya. And one of the things that we've seen recently is the consumption of bushmeat, what we call bushmeat. So snaring and trapping of primates for consumption. This has come about because of decreasing farmlands because of the wildlife human conflict. And so, for example, during the COVID situation, we found that the monkeys that were invading the farms were being trapped and of course, used as bushmeat. We know one of the sources of, like Dr. Yenu explained, one of the sources of emerging infectious diseases is from the wildlife to humans. And the way to, like Dr. Yenu said, to improve surveillance would be to monitor. But we know that some of these pathogens, when they are harbored in the wildlife, they do not cause disease. But because of when the increased bushmeat means that when humans consume, the same pathogens cause disease in humans. How do we monitor the pathogens that are harbored in wildlife, especially when they're not causing disease in the wildlife? But again, like I said, we are seeing increased consumption of bushmeat. And this has become a big menace, especially if you look at the Kenyan coast, where the conservation group that I work with operates from, because again, the decreased habitat for deforestation again, which also can be attributed to the climate issue. So I'm trying to see how, because I think this is one of the major nexus that needs to be addressed going forward, especially if you're going to effectively have surveillance of the pathogens as they cause emerging diseases in humans. Over. Thank you.
So, Dr. Yenu, do you want to give it a go, and then Dr. Yawanda will answer after you?
Yeah, thank you, Shingai. Thank you, Joseph, for that important question. So that's what I was emphasizing. It is important for us, to work with many other groups, like people working at animal conservation, government sectors managing wildlife and so on, and understand the behavior of the community, how that disease transmission. So as I mentioned, there are a group of partners that are using pathogen prioritization tools related to some genetic makeup of the existing pathogens, and then they are coming up with some list of potential viruses that may cross from humans, from wildlife to humans. And you need to also institute a strong education program with the human population, and you have to link also your intervention with environmental conservation, and all those are should come together as a package of intervention. Otherwise, there is no really one solution for all of these things. So you need to educate people. You need to work on research and development to prioritize those pathogens which can potentially cause outbreaks in human population. And then you need to also, understand, what's circulating in the wildlife, and then how that's related to pathogens that are causing disease in the human population. So we don't have really a very simple answer, but it requires a comprehensive approach. It requires really, engagement of multiple sectors and engagement of the community itself for change of behavior, and then working also on alternative source of means of survival for the community. That's why, as I mentioned, zoonotic diseases are on the rise because of people going to territories that they have never been before, and they are getting themselves exposed. So I think we need to address all of those factors and come up with a comprehensive strategy. Thank you.
Thanks, Dr. Yenu. Let me go to Mr. Kutane.
Thank you very much. One of my question goes to Dr. Yenu. So really is very important, this the One Health approach, and also I want to bring my question on the quadriparty approach that the UN and also Africa CDC is joining. But my question is, how is the ownership? Because this is a multi-sectoral. So how it is happening at the member state level in one country? Because, you know, this sector approach, sometimes I look at different sectors, they are established by the parliament with a different responsibility. From my experience, I do see the opportunity and also as one of the challenge, even to go to the household, that is what creating, because all the sector go by sector to the household. But the intervention is at the house, individual, and the community level is goes by one. So how is the ownership? Because it's good, the UN created that, 4 organizations created that quadruple party, and they are doing well. But who is owning this at the government level? So that is how Africa CDC or African Union is doing on that. If you explain that, and then what are the way forward for that? That is one of my first question, including the ownership. The second one is on the research for the other presenters. Even in the first panel, we talked about the research. The research also, how we are going to make an operational research. Most of the time when we are talking about research, we are talking about publishing. People are getting PhD, getting professorship. It's good. But how we are going to make this operational research by country level? I haven't said a lot in Mozambique. As part of the resilience health system, there is a health research agenda, which is lacking environment and the climate. For over 2 years, the expert group we developed us, and also 48 subtopic for the coming 10 years to be done as an operational research and then be part of the health research agenda for the country. The good thing, the Minister of Health is excellent. The minister endorsed that 5 thematic area and those 48 topics to be part of the national health research agenda. So how you are going to support for the country to have the research agenda linking the health, environment, and also animal, so that it can be part of the national research agenda, and then it will be used for the operational, for them to use for the health planning, implementation, and also monitoring. Thank you very much.
Thank you very much, Mr. Kutani. So let's go back to Dr. Yenu to respond, and then we'll come to our panelists in the room.
Thank you. I think that's a very practical question, and you know, very challenging. That's why you see One Health is much more spoken than it is done, because of that ownership and coordination challenge. So what we are recommending is at African Union level, in line with what Wande was mentioning as well, is that we have that coordination mechanism where we bring different sectors, peace and security, the plant science, the animal, vaccine manufacturing, and all those things together. And Africa CDC serves as a secretariat for that group to coordinate our multi-departmental response in relation to some of these challenges that require in One Health approach. So if we see our frameworks are also recommending the same thing to happen at country level. Countries should have a coordination mechanism. I know there are some attempts in setting up country level coordination committee for antimicrobial resistance. There are some countries which are doing very great on that, and there are some which are struggling. Even if you have a committee, so the committee may not meet regularly. And there are no really actions happening at the ground level. So I think our recommendation would be for countries also to give that responsibility. For example, they can give that responsibility to Ministry of Health, and the Ministry of Health should be able to reach out to those sectors and bring the team together. Or Ministry of Health can delegate national public health institutes to play that important role, because MPHIs, they are responsible for surveillance, lab response, lab capacity building, emergency response, and so on. And they look, really natural niche for One Health approach. And that's why, you know, our framework is for MPHIs to implement One Health approach. So it's a big challenge. It still continues to be a challenge, but there is no really, you know, one entity that will own a One Health program, but it will be creating that sustainable coordination mechanism to coordinate, you know, One Health response to some of these interventions. And that will continue to remain as a challenge, but we need to do better in terms of bringing all of those institutions together. Thank you. It is a very pertinent question.
Thanks so much, Dr. Yunus. So let's go to Dr. Agnes. What can be done to help integrate the research agendas?
Yes, thank you. That's a very good question. I remember when I'd just joined FHRC, I came from an institution where I had 80 publications. And my boss told me, so Agnes, how many of those publications have actually translated policy? So it's a very common drive for researchers. You write this proposal, get it put in there, dissemination, of course, get the PhD, publish, you have a good H score, you're cited on Google. And Catherine, my boss, Dr. Chibutunji would spill a whole of discussion on this. But at the end of the day, what are the things we promote is actionable research. You need to move the research from just publications. You disseminate, yes, get the policymakers in the same room, good. But then how do you make sure that even after the dissemination, the results are fed back into the research agenda? And there are various ways, Dr. Yenu has said, working with the National Public Health Institutes, because they are the research arm for many of these Ministry of Health. But secondly, I think one of the things that comes out from this discussion is researchers need to get bolder and get to the decision makers, the people who make the budget. Sometimes we stay away from that discussion, but you have your research, it has very good findings. It has a budgetary implication that can be embedded in the next financial year. I think there needs to be avenues or conduits for which the research gets to the planning authorities in the country. That is the only way that research moves from publications to mere dissemination to actionable items. And I think it's a culture that has to be embedded in all research training programs to take the results to the last mile if you were to make an impact from what you're doing. It's still like, it's a long journey, but I think we need to start somewhere from whatever research we do. Over.
Thanks so much, Dr. Agnes. So if you'll allow, I just want to make a comment about Africa CDC's contributions to the research agenda. So we acknowledge your point that a national research agenda is the framework of which budgets, direction, partners, and everyone work in the research field. But one of the challenges is, of course, that each country is producing their own research agenda, using their own framework, using their own prioritization. And so we're trying to say, how can we come up with a common framework of how do we define priorities? And it's so important, like you say, that in that framework, we are integrating a One Health approach. So we no longer have a health research agenda that excludes research that's concerning animal research and environmental. How do we bring this together so that we help to bring together units that we know work in silos? So this is work Africa CDC is currently working on to produce a framework for setting your national research agendas and priorities, and then taking that a step above to look at it from the continental level, to say, how do we look at priorities at a continental level? It's a big continent with very different problems in different regions, but we must be able to come up with a way that we can define priorities and help guide what research is needed and where. So we have the privilege of having Professor Sam Kariuki in the room, and he'll be giving our keynote address tomorrow at our side event at KICC for those of you who will be able to attend. So Prof, if you'll allow me to pick on you, I have a question. So he's the regional director for DNDi. And so you've got a ton of experience working in neglected tropical diseases. And from an institutional point of view, my question would be, we keep saying that climate related diseases and risks require a multi-sectoral response. So how can we better align stakeholders in terms of governments, non-governmental organizations, international bodies, so that they can develop adaptable strategies. Because one of the challenges linked to Mr. Kutane's question is the research agenda, what is done, who drives what is being implemented. Africa is often told what to do, and we just sort of do what we've been told. So maybe you can give us some insights from your organization and your experience. How can we do this better for climate change?
Thank you very much, Shinga, for that very, very pertinent question. And allow me also to thank the panelists for really a very, very vibrant conversation around solutions, especially on climate-sensitive diseases. We've touched a lot on AMR and other issues for which also DNDi is working closely together with GAP. Now, to your question, I think there are areas we must be able to really advocate through partnerships, especially getting communities engaged with us. And that has been a strong point also for DNDi, engaging the communities where we work, so that some of the solutions actually come from them. Some of the things that we think are very, very difficult for them to adopt actually came from them. So that's one perspective of it. I think the other perspective is that if we want to engage policymakers and especially even R&D, activities across One Health, we must find a platform to bring all these players together. Now, policymakers understand figures. You need to make sure that politician understands how many voters are going to be lost if we don't deal with these entities. Because they naturally look at us as votes. We must be able to speak that language. We must speak to policymakers about how many dollars are we going to lose from this coming budget if we don't deal with these issues that we are facing. And this really must be across the board, whether it's a Minister for Environment or Minerals, Minister for Works, Minister for Labor, Minister for Health. All these must be spoken to at the same time. We must also ensure that while bringing them together, then we are speaking also the language of the people. What do people want to hear? That we are being able to address the issue of cholera by making sure that they understand how this disease persists in our own environment. What must we do at that local level? And it must come from that local level, building up to stakeholders, because we cannot solve a situation or a problem unless we have those people we call our stakeholders, those people that we think we are serving, unless they understand the fundamentals of that problem. And that's why sometimes we fail. We think that we know a lot and that we are going to sort out the problem. But it must begin from the grassroots. Community engagement, let solutions start from there. And then build up that to stakeholders at policy level. As you said rightly, the politicians make the decisions on budget, national budgets, how much goes into research, what research priorities are there. But do we have our own pertinent data from the grassroots that feeds into that? And we can do that, but we can't do it unless we have data ourselves that emanates from our engagement with communities where we work. At DNDi, we are very, very keen to work with partners like AMREF, like yourselves, and we have been engaging quite a lot with Africa CDC to be able to bring a common agenda across countries where these issues persist. Because if you look at Africa, there are a number of hotspots for common diseases that we know about. So must we reinvent the wheel to be able to deal with one issue in one place and another issue in another place, whereas the issues are common? So those are some of the issues that I will be discussing. And hopefully tomorrow, during my presentation, I will be able to bring up some of these issues for common discussion. Thank you.
Thanks so much, Prof, for those insights. Do we have any other questions in the room? Yes, sir, at the back, and then I'll come to you.
Wait, thank you. My name is Leon Quito. I prefer to speak in French. OK. Oui, j'aimerais parler en français, particulièrement sur les aspects environnementaux concernant le One Health. Je pense que en parlant des changements climatiques, nous connaissons que la nature est liée à la santé. En d'autres termes, si la nature est détériorée, c'est-à-dire la santé aussi, va avoir un problème. Mais souvent, quand on parle de One Health, on a tendance à se focaliser de manière détaillée sur la santé humaine, sur la santé animale. Et concernant l'environnement, on se limite à dire tout simplement que non, les One Health dans l'environnement. Et on prend l'environnement comme une seule chose, alors que l'environnement a plusieurs dimensions. On ne sait pas préciser quand on parle de One Health dans l'environnement, on ne sait pas préciser. On va agir ou on va intervenir au niveau du sol, au niveau des écosystèmes aquatiques, au niveau de l'air. Est-ce que c'est au niveau des gestions des déchets dans nos villes? Est-ce que c'est au niveau des aliments vendus sur la voie publique? Est-ce que c'est au niveau de l'eau que nous consommons dans nos villes? Donc, on ne précise pas. C'est comme si vous parlez de l'environnement, c'est comme si vous parlez de la santé et vous dites à un médecin que non, soignez seulement les maladies. Mais vous ne précisez pas que non, il s'agit de la tuberculose, il s'agit de l'anthrax, il s'agit de malaria, mais vous dites seulement maladie. C'est comme ça que nous avons un peu de problèmes à résoudre certaines difficultés liées à la santé. Parce qu'une fois nous ne maîtrisons pas ce qui se passe au niveau de l'environnement, tout ce que nous pouvons intervenir, on peut avoir des traitements ou encore des antibiotiques de dernière génération, mais tant que la souche, tant que l'habitat ou encore la niche du micro-organisme ou encore des parasites n'est pas maîtrisé au niveau environnemental, tout notre effort sera nul et sans effet. Et particulièrement, je profite pour cette sommet sur le changement climatique en Afrique. Et nous savons bien que si le climat change, il y a plusieurs retombées néfastes sur nos vies ou encore sur notre vécu quotidien. Particulièrement si le climat change, il y a déforestation et dégradation des forêts. Et cette déforestation et dégradation des forêts peut nous amener à libérer les insectes, les virus et les bactéries, autrefois qui n'étaient pas en contact avec les humains. Mais comme il n'y a plus de forêts, comme il y a dégradation, ces virus, ces bactéries, ces insectes entrent en contact avec les humains et ils nous apportent tout ce que nous appelons comme zoonoses, comme maladies venant de ces insectes-là. S'il y a changement climatique, nous savons qu'il y aura tsunami, il y aura cyclone, et ces cyclones et tsunamis, c'est l'un des facteurs qui peut faciliter la transmission ou encore la propagation des maladies telles que l'anthrax causé par Bacillus anthracis, des maladies telles que Mycobacterium tuberculosis, très propagées par les vents. S'il y a changement climatique, nous savons aussi que la qualité de l'air, la qualité atmosphérique va changer. Et comme la qualité atmosphérique va changer, cela va impacter aux plantes. Et si les plantes sont impactées, elles finiront par disparaître. Et si les plantes disparaissent, et nous aussi, les humains, nous n'allons plus exister, nous allons disparaître. Autre chose, s'il y a changement climatique, la qualité de l'air va changer et cela va exposer la nourriture que nous mangeons, l'eau que nous buvons va être exposée et sera contaminée et cela va nous pousser à contracter des intoxications alimentaires, par exemple. Si le climat change, c'est-à-dire il y aura aussi des mouvements populaires que nous oublions. C'est-à-dire il y a des peuples ou encore des populations qui vont quitter leur pays, leur zone pour migrer vers des zones plus sûres. Et cette migration va entraîner tous les problèmes que nous connaissons. Il y aura hausse des criminalités. Il y aura une mauvaise assainissement. Il y aura plusieurs épidémies qui peuvent se déclarer. Il y aura même des conflits armés. Il y aura même des conflits par rapport à l'eau. Il y aura même des problèmes d'habitation. Les gens ne sauront pas où se loger. Il y aura même des mortalités infantiles qui vont s'accentuer. Donc, nous comprenons que non, avec les changements climatiques, il y a des effets néfastes et corollaires qui peuvent subvenir par rapport à ça. Et maintenant, dans tout ça, si nous analysons, l'unique solution, c'est comprendre ce qui se passe dans l'environnement. Parce qu'on ne peut pas se précipiter à soigner les gens dans nos hôpitaux sans comprendre réellement ce qui se passe dans l'environnement. Et c'est pourquoi nous, au niveau des UNEP, nous sommes en train de penser comment comprendre tout ce qui se passe dans l'environnement, comment établir les liens précis, des liens clairs entre l'environnement. Quand est-ce qu'un germe, quand est-ce qu'un micro-organisme quitte l'environnement vers un humain, vers un animal. Et si nous comprenons cela, nous pensons que nous, au niveau des UNEP, et bien sûr avec les différents panélistes qui ont voulu une collaboration, nous pensons mettre en place des standards que vous appelez en anglais des guidelines pour essayer d'évaluer qu'est-ce qu'il faut mettre dans l'environnement pour que l'environnement ne soit pas pollué. Qu'est-ce qu'il faut que nous ayons dans l'alimentation? Qu'est-ce qu'il faut que nous ayons dans l'utilisation des pesticides? Qu'est-ce qu'il faut que nous ayons dans la gestion des déchets? Et si tous ces facteurs, tous ces paramètres de l'environnement, on maîtrise, nous avons des guidelines, nous avons des standards, nous pensons vraiment agir de façon efficace pour lutter contre la présence des antimicrobiens dans l'environnement et accentuer ou encore renforcer l'implémentation des One Health à travers nos villes et nos pays. Et enfin, j'ai fini par dire que souvent les One Health, nous nous concentrons souvent sur le plan gouvernemental, nous sommes dans des workshops, nous sommes dans des conférences, alors que la vraie solution que nous pensons au niveau gouvernemental, au niveau des workshops tels que celle-ci, devait se focaliser pour voir comment est-ce que ce que nous avons peuvent se concrétiser au niveau local. Parce que nous pouvons prendre des décisions, mais si au niveau local, rien n'est fait, ça serait un peu difficile et ça serait un peu, entre guillemets, une perte de temps. Merci, j'ai pris un peu beaucoup de temps, mais veuillez m'excuser, merci. J'ai fini.
Thank you so much for very important points raised. It is incredibly important that we start to bring things together. So we're a little bit better with bringing the health and the zoonotics together, but environment is still separate. So points well noted for us, and we need to see how to integrate and bring these conversations to the table. So I'm going to take one last question, then we'll go for lunch, and then we'll continue the discussions after lunch. Please go ahead.
Thank you very much. I'll try to be brief because I'm sure people are looking forward to having lunch. I was saying thank you very much. I'll try to be brief with my comments or questions because I'm sure everyone is hungry. My name is Dr. Masika. I work for the World Federation for Animals as a UNEP liaison officer. And my comment is almost linked to what my colleague has said from UNEP. And this is directed mostly to the first panel that was talking about our solution being that we need to be more people-centric when you're coming up with these solutions. I do have a differing opinion because as a veterinarian and working with UNEP, I have been forced to learn the nitty-gritties of environment and the triple planetary crisis. I think being people-centric is the reason why we are talking about climate change, is the reason why we are talking about pollution, plastic pollution, and biodiversity loss, because we have been looking at things that are benefiting us as humans. So that is why we are doing a lot of fossil fuel harvesting. We are degrading our environment to benefit the human population. But I think that antithesis of people-centrism is ecocentrism. So looking at the health or the benefits of all the living beings on the ecosystem as equal. That way we come up with solutions that are catering for the human health, for the animal health, and the environment health. And that's why we have people in UNEP complaining that the environment is often mentioned in One Health as a passing topic, because as professionals, we have not taken a very keen interest to learn the environment, the different ecosystems within our environment. And like Dr. Ahmed said in the beginning, it's important that we build capacity amongst ourselves to be able to
be to converse about as a veterinarian, I should be able to effectively converse about the environment and the human sector equitably, to be able to contribute effectively to policies, guidelines, and strategies that can be able to enable us in mitigating the climate change and the impact of climate change. And this brings me to another comment that Dr. Ahmed said, going back to indigenous knowledge. As Africans, our ancestors were very ecocentric or biocentric in nature. They looked at the health or catered for the welfare of the environment they were in. And that's why climate change is happening right now. It didn't happen 50 years ago. And I think we need to go back, step back, change lanes, and make sure that we are implementing solutions that will be long lasting. And the last thing I'm gonna say is about most of the presentations were touching on surveillance, were touching on response, were touching on preparedness, but very few of the presenters talked about prevention. And in the PPR pathway, prevention is the weakest link, but the best solution, the most equitable solution, the most cost-effective solution when it comes to pandemic prevention. And we are not paying as much emphasis to it, and we are not looking at the anthropogenic factors that us as human are driving that is leading us to where we are talking about pandemics, you're talking about climate change, you're talking about biodiversity loss. So I'm hoping in the next panels and the next conversation that we are that we're going to witness in the afternoon or even tomorrow, we need to talk about prevention more as the first step to pandemic preparedness or pandemic prevention. Thank you very much. Thanks so much for that contribution. Very interesting point of view. And I think you definitely are right that we need to pay better attention to what is needed from a perspective that is not centered around ourselves. So in the interest of time, I'm going to break so we can have lunch, but you are right, we have several other panels, and many of the discussions are going to touch on some of the issues that you have raised. So just to close off this panel, we heard many different things, but some key takeaways for us to digest as we have our lunch. We heard that we need multi-sectoral collaboration. We heard that African countries need ownership of whatever is being done in their countries. We heard that we need partnerships, and not just partnerships, fair partnerships. We heard that we need to speak political English so the decision makers can understand what we're saying. We heard that we need to understand the dollars and be able to talk about the dollars and speak economic sense. We heard that community engagement is key. We heard that it's important to share experiences so that we do not recreate the wheel. And lastly, we heard about ecocentrism. And I must confess, it's the first time I'm hearing about it. So happy to hear more from you all. So thank you very much to our two panels for today, from this morning. If we can give all our speakers a round of applause. We're going to break for lunch, and we'll meet back here at 3 o'clock. So lunch is served one floor below us on the first level. If you take the stairs down and turn to your right, you'll find the restaurant. So enjoy your lunch, and we'll see you back here at 3.
Recording stopped.